Hello, and welcome back to 10 Minutes With. Today I'm joined by Roseline Favresse, EURORDIS' Research, Policy and Initiatives Director, and also the lead on ERDERA. Thank you for joining me, Roseline.
Thank you, Ria.
So, can you tell us a little bit more about what ERDERA is and why this is such a significant new partnership in the rare disease research field?
So ERDERA stands for European Rare Disease Research Alliance. This is a rare disease partnership, so a massive joint effort from the European Union, from the member states, European member states, from associated countries to Horizon Europe, which is the main research funding program in Europe, and also from the industry, because there's industry involved in this new partnership.
So it really is multi-stakeholder, covering sort of every person, every type of actor within the rare disease community.
Absolutely. So it started on the 1st of September this year, so a few weeks ago, and it's going to last for 7 years, at least. The whole amount of funding from the European Commission and also from public-private stakeholders is more than 380 million euros, with a total funding from the European Commission amounting to 150 million of euros. And with more than 170 partner organizations. So it's really a massive amount of people and funding pulled together to develop patient need research on rare diseases and to really transform the rare disease research ecosystem in Europe.
So, I mean, it's clearly an incredible feat that it's encompassing so many different people and, like you say, such a huge amount of funding. How is ERDERA different to what has gone before, to its predecessors?
So it's really building upon the long involvement and support from the European Commission to this field of rare disease research, but it's really going a step further, meaning that in the past, the European Commission and also member states, so each national funding bodies involved in rare disease research support, were funding different research projects. And also the European Commission was also supporting this coordination of funding from the different member states. But with ERDERA, we're going a lot beyond the funding itself. There's a number of new activities, including the clinical research network. There's also a further alignment on international and national capacity building. And also as a patient organization, there's also more patients organizations involved and also more patients involved in the different work streams.
Amazing. And I'm sure it's probably so difficult to put such a multifaceted project into a box in this way. So I apologize in advance. But would you say that is the main goal of ERDERA? The main aim is to bring back innovation to Europe in the rare disease field?
Yeah, this will be potentially the positive outcome. But I think first, I mean, the main objective is to do research, to accelerate research, to transform research outputs in concrete solutions for patients. So I think ERDERA could be described as bringing all the different resources, skills, competencies under one roof. So making one relatively complex, as you said, project to coordinate, but really having all the stakeholders at one point. Of course, it's a lot of stakeholders. Who will be more than 1,500 individual participants. So there's clearly a challenge for the coordination, but it's really also a massive effort for the community to come along together.
And what is EURORDIS bringing to ERDERA that's perhaps unique from other stakeholders that might be involved?
We're building upon more than 15 years of training experience. So we're we've been developing a number of capacity development tools and trainings. So we're building upon this expertise. We, as a federation, we're also building and driving things together with all the members. So it's more than 1,000 members we're representing at the moment. So we're coming with this strong power of the patient voice at the European level. Also at EURORDIS, we've got a Council of National Alliances, so really in touch with the different activities in different countries. So we're really bringing this national embedment perspective as well. And I would say also that we are bringing what we've been doing in patient engagement, guidelines, drafting practices in the field, should it be through different projects we've been involved, funded by the European Commission, but also having developed some projects with the industry, for instance, about the development of advanced therapies. We've been involved in different multi-stakeholder meetings. So we've got really this culture of collaboration with different stakeholders that we're bringing to the consortium.
So for the people at home who might be watching this and are, ticking all of these things off on the list and saying, this sounds great, but what does it mean for me? What do you foresee the impact being for people and their families who are living with a rare disease, or for people who maybe have just started their patient advocate journey, who have maybe just gotten a PhD and are starting their rare disease research journey? How can they get involved?
So for patients and the families who would like to be involved, what we've been setting up in ERDERA is a point of contact at the coordination level, what we call a patient and public involvement and engagement group. And we will be welcoming any incoming request for participation, and we will be channeling the people to the right place, basically, to answer their specific needs, because they will come with different requests and needs. So we will be helping them to onboard the project so they can be involved and engage at different levels. Of course, there's a lot of training opportunities which will also be available for patients and families. So we have started with a few call for applicants earlier this year in September. And there will be plenty of training opportunities. So they really have to either ask us on a regular basis or follow our different social media where those opportunities will be advertised. Aside training and participating in projects, either as direct participant or evaluators or profiler of the future topics, there's also the national component I was mentioning, because I think we might have people in different countries watching us. So there will be those national mirror groups, so like small ERDERA in all countries. So it's beyond Europe itself, because ERDERA is spanning over 37 countries at the moment. So there's really an opportunity to go and be involved at the national level, to potentially also as patient representatives, if they're belonging to patient organization, to lead that national mirror group, and if not leading, to be involved in the discussion at the national level, because the objective is really to streamline also the efforts being done on research on rare diseases at the national level, and to make sure that we're all advancing in the same direction, and that we are not duplicating, and also that we are not leaving anyone behind or lagging behind.
And we usually like to end these conversations by asking for your piece of advice for, normally it's required to policymakers as to what they can do to support the work or the topic that we're in conversation about. Obviously for ERDERA, it is already being hugely supported by the European Commission, and we can't underestimate the massive impact that has had in the years that they've been supporting this field. So in this particular instance, what would be your cry to maybe national policymakers, or maybe it is a cry to European policymakers, but in perhaps another area, that basically you would like to say, if you come away from having seen this video, this is the one piece, this is the one message that you should take away, this is the one piece of advice that I want you to remember?
Well, I do like the fact that you're mentioning the national level. It's obviously one component of a very big, wide partnership. But I think we can't go with only one EU solution. There's a need for support and grounded efforts in all countries. So if you are seeing us now and you're thinking, okay, what can I do? Maybe go to your national authorities, your ministries, and try to use what will be developed at the European level in this partnership, and try to embed this in your country. Should it be training? Should it be about new diagnostic pathways? Try to have them translated in national processes, in national organizations, so that we can give equal chances to all European people and beyond, because once again, it's not restricted to EU.
Yes, and I think that's another thing, again, to drive home that this is really for all Europeans, and like you say, beyond the typical 27 EU countries that maybe people would presuppose that would be involved in ERDERA.
No, definitely there's a number of countries who are even not part of Europe geographically. There are partners from Canada. There are partners from Turkey as well.
Oh, wow.
So it's really the objective is to build upon what has been developed so far, and try also to learn from the others, because there's a number of interesting things being developed elsewhere.
I'm sure.
And try also to maximize impact for rare disease patients at the international level.
Amazing. Thank you so much. Thank you for watching 10 Minutes With. This has been Roseline Favresse and me, your host, Rhiannon Walls. Make sure to tune in next time.